Well, South Africa has recorded its highest single-day increase of over 14,000 cases. The health minister is also warning the country will surpass the peak of the first wave in the coming days. The new surge is being driven by the new variant. So let's discuss this with the Health Department's Deputy DG, that's Dr. Anban Pillay. Dr. Pillay, thank you so much for your time. Quite worrisome. I mean, we're seeing there double digits now, 14,000 recorded in just a day. I mean, shoosh, is this going to get any worse than we're already seeing?
Thank you. Good morning to you and to the viewers. Yes, I mean, we've passed 14,000 today, and in our last surge, we were averaging around 12,000 per day before it then started declining. But with the new variant and the festive season, where we know that many people associate this with a period of socializing, we anticipate that there'll be higher levels of transmission unless we change our behavior and adopt the non-pharmaceutical interventions of mask wearing and social distancing, because that's the only way we're going to break this rise in infections.
Yeah. I mean, Dr. Pillay, what does this then mean just in terms of the regulations that are already in place? Does it mean that there's a possibility that, you know, the minister, cabinet, the department might need to revise just so to try and, you know, obviously control these numbers of infections?
Yeah, we've been talking to our colleagues in the provincial departments to try and understand what measures additionally we could put in place to what we have currently, so that we can restrict some of the social behaviors that are driving this transmission. Because as the minister had indicated, we anticipate that if these behaviors don't change, we'll probably surpass the 12,000 average and move more towards 15,000 per day, which means we could shoot to about 20,000 on some days if this doesn't change in the short term.
And for those perhaps who don't understand exactly how this, you know, variant works, I mean, can you just give us some context here? We know that it's spreading rapidly at this stage. We know that it's also infecting more South Africans quite rapidly as well. But what else can you share with us in terms of this new variant of the virus?
So the new variant of the virus has changes in its spike protein, and that makes it much easier for it to transmit and attach onto cells. And the ability of the body to be able to recognize it is still a question we need to answer. But what's very clear is that when somebody is infected, they're able to infect another person much more easily with the transmission of the virus. I should also say that, you know, we're sitting at a number about 14,000 yesterday. That's only the tip of the iceberg. Remember, there are many more people out there who don't feel sick and are infected, and if they're not wearing a mask, they're busy spreading that infection to many other people. So it's really important to understand that 14,000 is probably a way smaller number than the actual number of people out there, because many people are infected, they're well, they don't go into the health system to be tested because they feel well, but they actually are carrying the virus and busy spreading it to everybody else. And so that's why it's really important that they wear masks.
Yeah. DG, rather, I mean, we were also seeing, you know, just non-compliance. And obviously, the minister has often said that it's important for our behavior to be quite, you know, strict and just disciplined during this time. We're seeing, you know, more young people hosting events on highways, obviously posing a threat and danger in terms of road safety, but also not complying with COVID-19, because it's these super spreader events, these many gatherings that are part of the reason why we find ourselves with such increased numbers. I mean, what is government doing about this to stop this rate of non-compliance that we're seeing, especially during this time around the festive season?
It's usually not, you know, in government's interest to criminalize, you know, normal social behavior of people interacting, etc. So we try and use the messaging of trying to get people to understand the consequences of this behavior. And we're hoping that that will change, because criminalizing this means that you now have to have a police force out there in numbers watching everybody all the time and trying to enforce this in a manner which usually doesn't achieve the behavioral change. we're hoping that young people understand that when they're infected, even though they may not be feeling ill, they do take the infection home. And if they have any regard or care for their parents and their grandparents and their family, they would understand that this will infect them, and they may not have the same course of disease and may end up in hospital and ICU, etc. And I don't think anybody really wants that for their families.
Absolutely. I mean, even the healthcare, just the industry and some of the healthcare professionals appealing that they would not want to be, bombarded with more traumas and cases unnecessarily over and above those of COVID-19 with which they are, under strain with. But with that being said, when we focus on hospitals, as a department, can you assure right now that, in as far as PPE is concerned, ventilators, any support that the healthcare workers and the facility needs are being taken care of?
Look, we have sufficient PPE in the system, and that I think each of the provinces will distribute as they see increased demand in particular facilities. We've put in place a visibility system to monitor that. In terms of the ventilators, we've produced, you may know locally, a significant amount of ventilators which is available to use. But having said that, I do want to emphasize the point. Ventilators and ICU work requires very specialized skills in terms of doctors and nurses. And so we'll be able to make ventilators, we can produce PPE, but what we cannot do overnight is produce the health professionals for ICU. So those are some of the rate limiting steps in terms of us managing large numbers. So that's why we're really appealing to people to limit their social interactions, wear masks, social distancing and hand sanitizing, very critical.
All right, then we'll leave it at that. Dr. Anban Pillay, thank you so much for your time.